Welcome to B24 Media, your gateway to the future of business news. In today's fast-paced world, staying ahead means staying informed. That's where we come in. At B24 Media, we specialize in delivering live-streamed business news, empowering professionals, entrepreneurs, and decision-makers with the knowledge they need when they need it. Our platform is more than just news. It's a 24/7 pulse on the global business landscape. From breaking market trends and live earnings calls to insightful analysis from industry leaders, B24 Media puts the power of information in your hands, live and unfiltered. Whether you're tuning in on your morning commute, preparing for your next big pitch, or simply staying ahead of the curve, B24 Media is your partner in progress. Because in business, timing is everything. And with us, you'll never miss a beat. B24 Media, where business meets the future, live. In today's program, we will highlight the following.
At B24 Media, we're all about empowering businesses to shine in the digital world. Imagine a platform where your brand can connect with your audience in real time. Our daily live streaming programs do just that. We blend innovative advertising solutions with engaging content, ensuring your message resonates. Whether you're showcasing your latest products or sharing valuable insights, our tailored services keep you relevant in today's fast-paced landscape. With cutting-edge technology at your fingertips, your brand doesn't just advertise, it thrives. Join us at B24 Media, where your digital presence transforms into a powerful connection. The Toronto real estate market has seen some significant ups and downs in 2024. In November, we recorded 5,175 home sales, an 11.8% drop from October, but a remarkable 39% increase compared to last year. Active listings decreased to 21,118, down 10.9% from the previous month, yet up 30.2% year over year. New listings also fell by 24.4% from October, but interestingly, they're up 9.9% from last November. Pricing trends show a modest year-over-year increase of 2.6%, though we did see a slight 0.5% dip from last month. Key players like Right at Home Realty, Home Life Landmark Realty, and Royal LePage are shaping the landscape, while Starlight Investments dominates the rental market with 70,000 multifamily units. Looking ahead, the market is poised for recovery into 2025, driven by lower borrowing costs. But challenges like housing affordability and inventory levels will continue to play a crucial role.
How a heart attack occurs. During a heart attack, blood flow through a coronary artery is suddenly stopped or severely restricted. See this as a heart attack. When the area of heart muscle, myocardium, that relies on this artery is deprived of oxygenated blood for more than a few minutes, all or part of it can die, a process known as infarction. Experts have coined the phrase "time is muscle" to refer to the urgency of restoring this vital blood flow. In short, a heart attack is an emergency because the sooner you undergo treatment, the greater your chance of recovery. Half of all patients who die from a heart attack do so within 1 hour of experiencing their first symptoms. After 6 hours, damage to the myocardium is usually permanent and irreversible, although opening a blocked artery 6 or more hours after the first symptoms occur sometimes can be successful. See the symptoms of a heart attack. That being said, about 20% of heart attacks cause no symptoms or someone is having a heart attack. Anyone exhibiting symptoms of a heart attack is first diagnosed with acute coronary syndrome. An ECG and blood samples are used to determine whether the heart actually has been injured and, if so, how severely. Sometimes, the clinical signs and symptoms together with the ECG recording indicate that treatment must begin immediately. Although much progress has been made to identify high-risk patients, low-risk individuals still pose a diagnostic challenge for physicians. New finding: aspirin underused in secondary prevention. Despite recommendations encouraging the use of aspirin for secondary prevention of major cardiovascular events, many people who've had a heart attack are not taking the medication. In a recent study, researchers reviewed data from health surveys conducted among 124,505 people, ages 40 to 69, in 51 low, middle, and high-income countries between 2013 and 2020. Among the 10,589 respondents with a history of cardiovascular disease, only about 40% were taking aspirin. The use of aspirin ranged from 16.6% in low-income countries to 65% in the United States and other high-income countries, the study found. Post-heart attack care. For most individuals, a heart attack is a sobering experience, a wake-up call, if you will, that they are not immortal. The days immediately after a heart attack are a good time to plan how you will prevent another heart attack. The medications you will be given and lifestyle changes you will need to make after your first heart attack to prevent another attack are called secondary prevention measures. 1. Stay on your medications. 2. Enroll in cardiac rehab. Advanced treatment options for heart failure. When medications alone are not enough to manage heart failure, advanced options may be necessary. Cardiac resynchronization therapy. When lack of synchronization between the upper and lower chambers of the heart reduces its ability to pump, cardiac resynchronization therapy, CRT, may be recommended. CRT involves implanting a pacemaker, usually in the left front chest below the collarbone, and threading 3 electrodes into the heart through a vein. The electrodes are programmed to stimulate both sides of the heart simultaneously. The frequency and timing are adjusted to optimally coordinate the contractions to produce a more efficient heartbeat and better blood flow, which improves heart failure symptoms and quality of life and reduces complications and risk of death. CRT is a minimally invasive procedure that does not require opening the chest to access the heart. Conclusion. Then, if you still need additional support, talk with your doctor about medications and other treatment options to reduce your cardiovascular risk. Be sure to take any medications exactly as your doctor prescribes them, and review any obstacles, e.g., side effects, cost, that prevent you from adhering to your medication regimen. We hope you'll use what you've learned from this special health report to engage in informed discussions and shared decision-making about your cardiovascular health with all of your healthcare providers. After all, it's not your doctor's job to reduce your risk of CAD, heart attack, or heart failure, it's yours.